here at the Center for Health Innovation. Today, we're going to be taking you through what it is the Center for Health Innovation offers and the services that we have here. The Center for Health Innovation, or the CHI, came to be in October of 2020. We were previously known as the Ottawa Integrative Cancer Centre, or the OICC, which was founded in 2011. We changed our name and we moved to a new location in downtown Ottawa. At the CHI, we provide supportive and integrative care for people with cancer, and we've also expanded to treat a number of other chronic conditions as well, such as cardiovascular disease, thyroid health, chronic fatigue and fibromyalgia, mental health, women's health, hormonal imbalances, diabetes, and more. This is a flagship location where patients can receive a number of different therapies all under one roof. When I'm describing to patients the types of therapies that the CHI offers, I like to describe them as falling under one of three main pillars. So we have our integrative medicine, we have physical medicine, and then we have mental and emotional medicine.
Hi, I'm Jessica. I'm one of our intake coordinators here at the CHI. At the CHI, we have naturopathic doctors who have a special focus on complementary cancer care. We see patients at all stages of their cancer journey, whether that be for preventing cancer, they are recently diagnosed, they're actively ongoing treatment, or wanting to prevent a recurrence. Our naturopathic doctors work with patients to decrease the side effects of cancer treatment, improve the energy, well-being, and overall quality of health, balance the body's immune system, support the mind, body, and spirit in the healing process, and provide supportive strategies for cancer prevention and health maintenance. There's so much information out there and it can be very daunting and overwhelming. Our naturopathic doctors can help you navigate through all that information, tell you what's evidence-based, and may actually be effective and helpful for your personal case, your diagnosis, your situation. Patients often ask us questions such as, what is the best thing that I can do for myself? I've heard of this treatment. Is that something that I can do here? Is there any supplements that I can take that would help mitigate this symptom from chemotherapy or help reduce my tumor growth? Is there anything that can help with making chemotherapy more effective? All integrative therapies are designed to be supportive and in alignment to hospital-based care and conventional medicine as a whole. So no two patients are alike, and that means that no two treatment plans are alike. Our naturopathic doctors will design something for you.
Also falling under the pillar of integrative care, we have our integrative nurse practitioner. Our nurse practitioner is a liaison for patients to the conventional medical care world. Nurse practitioners come from a nursing background where a holistic approach is utilized as opposed to more of a disease-centered approach. A nurse practitioner is very similar to a medical doctor in that they're able to order comprehensive tests, they're able to diagnose, they're able to order lab work, they're able to refer to a specialist, etc. Our nurse practitioner is also able to have consultations with patients about cannabis and prescribe cannabis to patients if that's indicated for them. Although she's not certified in functional medicine, our nurse practitioner Jamie is very passionate about providing high quality integrative care and using a functional medicine approach to get to the root cause of your symptoms and to help guide further management. Jamie specializes in primary care and has a special interest in mental health, pain management, cannabis, digestive health, including irritable bowel syndrome, nutrition, and more. Let's start off with acupuncture.
Hi, I'm Sabrina. I'm the assistant manager here at the Center for Health Innovation. Acupuncture is a form of traditional Chinese medicine, or TCM, that has been practiced for over 3,000 years. It acts to balance and rebuild the body's qi. Using the TCM diagnosis, acupuncture can be used to treat a variety of different conditions. So some of the most common conditions that TCM can treat include stress and anxiety, heart palpitations, irregular heartbeat, sexual dysfunction, women's conditions, respiratory issues, vertigo, gastrointestinal issues, urinary issues, and pain and fatigue. Our TCM practitioner, Jiao Tran, also uses traditional Chinese medicine herbs to create a variety of different concoctions based on each patient's individual needs.
Moving on, we also offer physiotherapy to our patients. Physiotherapy can be very helpful for reducing pain, stiffness and swelling, and aiding in pre- and post-surgical recovery and range of motion. Our physiotherapist, Sarah, is also a certified lymphedema therapist. So this is particularly helpful to our patients with cancer who might also have concerns about lymphedema. Next, we have registered massage therapy, which is very helpful for concerns of muscles, connective tissue, fascia, tendons, ligaments, and joints. Registered massage therapy can also aid in pre-surgery healing and can be helpful post-surgically as well. We also have Thai massage, which is helpful in relieving trigger points that might feel sore or be causing us pain. We also offer personal training, where a personal trainer will help you incorporate movement and exercise into your treatment plan. Our personal trainer customizes every recommendation to the individual. So to take into account things like accessibility and physical limitations to make sure that every plan is tailored to the individual person. We also offer craniosacral therapy, which is where the practitioner uses a very soft touch on the bones of your skull. Craniosacral therapy is helpful for migraine headaches, chronic neck pain, chronic back pain, neuropathy, which is painful nerve endings on the skin or in the hands or feet, fatigue, emotional difficulties, stress, and tension. Craniosacral therapy is actually one of the most accessible forms of hands-on treatment at any stage of wellness. And this is because craniosacral therapy can be done while the patient is fully clothed and can be done in any position where the patient feels restful and comfortable, so lying down or sitting down. And last but not least, we have our mental/emotional health pillar. There is an undeniable connection between our emotional health and how we feel in our physical bodies, and our physical health and how we're feeling mentally/emotionally. This is called the mind-body connection. Under this pillar, you'll find psychotherapy, hypnotherapy/visualization/mindset coaching, and yoga therapy. At the CHI, we have a registered psychotherapist who offers psychotherapy in groups or to individuals. Psychotherapy can be helpful to help people process and cope with various life challenges, such as family issues, anxiety, depression, the challenges of living with chronic illness, or dealing with death and dying. We also have a hypnotherapist/visualization/mindset coach at the CHI. I love to explain what she does by sharing a little example. So for example, we had this patient who was very nervous and stressed about an upcoming surgery. So they used a few hypnosis sessions to reduce their stress and anxiety going into their surgery. Our hypnotherapist/visualization/mindset coach also does a lot of work in the mindset area. So that's your subconscious inner voices. So she works to help people restore their mindset, to help them better cope with stress and to restore it to a more positive place. I also wanted to touch on some of our free online programming. This started in the spring of 2020. When things were closing down, we wanted to be able to provide supports to patients while also ensuring their safety by respecting public health guidelines and having everyone stay at home. Thus, our virtual programming was born. So we offer virtual programs via Zoom for free of charge to patients because we want to be able to offer patients resources to help them cope with stress and to support their mental health during these very challenging and stressful times. We have several free online program offerings, such as Consciously Creating Calmness, Gentle Yoga, Meditations for Troubled Times, support groups for people who are living with uncertainty, and a support group for a safe place to talk about death and dying. Again, these programs are being offered virtually so that anyone can access them, and they're also being offered free of charge. Feel free to learn more about them and to sign up on our website. Lastly, I wanted to touch on a few of the commonly asked questions that we get as intake coordinators. This is a fee-for-service clinic, so that means for every service or therapy that a patient receives, there is a fee for that service. However, many of our services are covered by private insurance plans, such as massage therapy or physiotherapy or naturopathic medicine. In that case, if a patient does have coverage, they'll take the receipt that they get after their appointment and submit it to their insurance company for reimbursement. Coverage does tend to vary from person to person and plan to plan, so we always recommend that people check their individual insurance plans to make sure they know what their coverage is. Right now, most of our services are being offered virtually, and that's to ensure the safety of our patients and for the safety of our practitioners. So if a service can be offered virtually, so for example, services like naturopathic medicine or psychotherapy, those are being offered virtually via secure video chat. Services that don't really make sense to be offered virtually, such as massage therapy or acupuncture, are being held in person with additional safety precautions in place. Patients are able to self-refer to the service or services that they feel they would benefit most from. So patients do not have to see a particular practitioner or have to see practitioners in any particular order. Patients are able to choose what they think would be most beneficial for them. And of course, if you're unsure or you have any questions, you can always give us a call. If you'd like to book an appointment at the Chi, there are two ways you can do that. You can do so online, or you can do so by giving our clinic a call. Please feel free to give us a call at any time during our hours of operation, and one of our intake coordinators would be happy to speak with you and to answer any questions you may have. If you're ready to go ahead and book online, here's how you can do that. Go to www.thechi.janeapp.com. This is where you can book an appointment and register to make an account. You're going to see a list of services here, and you're going to see our list of practitioners here. You can select the service that you want to receive and go ahead and select an initial consultation. There you go, that was pretty easy. Lastly, we want you to know that if you have any questions whatsoever, we are always more than happy to help you. You can always reach out to a member of our team, and we'd be more than happy to assist you in any way that we can. Take care, and thank you so much.